Hello everyone. I am going to be discussing a brief overview and an introduction to general anatomy and its importance to dentistry. I am Rogielle Andrew M. Abog of Group 1 from DTM 2A2, and I'm here to discuss basically just a short, brief overview about the systems in our body, mainly in an introduction to general anatomy. General anatomy. General anatomy is the study of the structure and composition of the body, as well as of its tissues and fluids. So it's not only about the parts of our body, but also the contents and even the smallest and tiniest details of our body is included in this course in this subject. So general anatomy helps us develop a basic understanding of the structure and function of body organs and systems and their interactions. So each part of our body gives us an idea that even the littlest part, even from the littlest bone to the veins, they have interactions within them. So it also gives us a sense of understanding and how important it is to note the different duties that each part of our body has in maintaining life. So the duties and responsibilities of the different parts of our body enable us to maintain living a healthy life, doing our daily routines and whatnot. Yes, that's it. Next, a discussion overview. So we have like five topics to cover, though I mean four. It would be the introduction to general anatomy, which was earlier, different systems of the body, the classification of bones or bones in general, and the effects on sex, race, age, and structure. And lastly, a rationalization on the importance of the course in dentistry. So let's start with the different systems of the body. So there are the three there, lymphatic, nervous, and the three types under the nervous system. So the lymphatic system, it consists of lymphatic tissues and lymphatic vessels. So under the system, we have these two, the tissues and the vessels. So lymphatic tissues, they are a type of connective tissues that contain large number of lymphocytes. Lymphatic tissue is organized into the following organs and structures. They are found in the thymus, the lymph nodes, and the lymphatic nodules. Lymphatic tissues are essential for the immunologic defenses of the body against bacteria and viruses. So they play a huge role in protecting our body from bacteria and foreign objects and viruses, especially with the COVID-19 and our booster vaccines. So they work together. So lymphatic vessels, on the other hand, they are tubes that assist the cardiovascular system in the removal of tissue fluid from the tissue spaces of the body. So they help our cardiovascular system remove tissue fluid from the different tissue spaces that are found in our body. So they are essentially a drainage system, and there is no circulation that happens within these vessels. Lymph is the name given to tissue fluid once it has entered a lymphatic vessel. So lymphs are what we call the tissue fluid that enters the lymphatic vessels. Lymph capillaries are a network of fine vessels. They are small, even tiny network of vessels that drain lymph from the tissues. So next we have the nervous system. So the nervous system is divided into two main parts, mainly the central nervous system, which encompasses the veins, the spine and the head, and the peripheral nervous system, which affects our entire body, the rest of our body. So the nervous system. Functionally, the nervous system can be further divided into the somatic nervous system, which controls voluntary activities, such as swallowing, and the autonomic nervous system, which controls involuntary activities such as tics and the pumping of the heart. The nervous system, together with the endocrine system, controls and integrates the activities of the different parts of the body. So next, we have the central nervous system. The central nervous system is composed of large number of nerve cells and their processes supported by specialized tissues called neuroglia. I'm sorry because I have a hard time saying these words, neuroglia. So the central nervous system, they are large numbers of nerve cells and their process with their processes. The interior of the central nervous system is organized into gray and white matter. So we have the gray matter and the white matter. So they are two. Gray matter consists of nerve cells embedded in the neuroglia, while the white matter consists of nerve fibers or axons embedded within the neuroglia. So the gray matter consists of nerve cells, while the white matter consists of nerve fibers or axons. To get that into note. So the peripheral nervous system. The peripheral nervous system consists of the cranial and spinal nerves and their associated ganglia. So I was from the previous. So we have the cranial nerves, the spinal nerves, and the plexuses. The cranial nerves. There are 12 pairs of cranial nerves that leave the brain and pass through the foramina and the skull. All the nerves are distributed in the head and neck except the 10th or the vagus, which also supplies structures in the thorax and abdomen. Spinal nerves. A total of 31 pairs of spinal nerves leave the spinal cord and pass through the intervertebral foramina and the vertebral column, named accordingly to the region of the vertebral column they are associated with. So we have 8 cervical, 12 for thoracic, 5 for lumbar, also 5 for sacral, and 1 for coccygeal. So a total of 31 pairs. So in the spinal nerves, during development, the spinal cord grows in length more slowly than the vertebral column. In the adult, when growth ceases, the lower end of the spinal cord reaches inferiorly as far as the lower border of the first lumbar vertebra. So it reaches up until the buttocks, just before the buttocks. So each spinal nerve is connected to the spinal cord by 2 roots: the anterior root, the front, and the posterior root, the back. The anterior root consists of bundles of nerve fibers carrying nerve impulses away from the central nervous system, while the posterior root consists of bundles of nerve fibers that carry impulses to the central nervous system and are called afferent fibers. So anterior root away from the central nervous system, while the posterior root towards the central nervous system. They carry impulses. Okay. Because these fibers are connected with conveying information about sensations of pain, temperature, touch, and vibrations, they are called sensory fibers. The cell bodies of these nerve fibers are situated in a swelling posterior root called the posterior root ganglion. Thoracic spinal nerves also have branches called the rami communicants, which are associated with the sympathetic part of the autonomic nervous system. The plexuses. At the root of the limbs, the anterior rami join one another to form complicated nerve plexuses. The classic division of the nervous system into central and peripheral parts is purely artificial and one of descriptive convenience because the processes of the neurons pass freely between the two. So they pass freely between the two. So the autonomic nervous system. It is part of the nervous system concerned with the innervation of involuntary structures such as the heart, smooth muscle, and glands throughout the body and is distributed throughout the central and peripheral nervous system. So they are divided into 2 parts, the sympathetic and parasympathetic. So the autonomic nervous system is concerned with the involuntary parts of the body, and the innervation such as the heart pumps itself. It is involuntary pumping. The sympathetic system. Okay, so the gray matter of the spinal cord from the first thoracic segment to the second lumbar segment possesses a lateral horn or column in which are located the cell bodies of the sympathetic connector neurons. Activities of the sympathetic part of the autonomic system prepare the body for an emergency. It accelerates the heart rate, causes constriction of the peripheral blood vessels, and raises the blood pressure. So sympathetic system enables our fight or flight response in life. So we have the impulses where we just want to run. So this comes from the sympathetic system. We want to run in a problem, away from a problem, or those kinds of things. We want to run away from them. So these impulses come from the sympathetic system. So the next, sympathetic trunks are two ganglionated nerve chunks that extend the whole length of the vertebral column. There are 3 ganglia in each trunk of the neck, 11 or 12 ganglia in the thorax, 4 or 5 ganglia in the lumbar region, and 4 or 5 ganglia in the pelvis. The true trunks lie close to the vertebral column and end below by joining together to form a single ganglion, named the ganglion impar. So the parasympathetic system, on the other hand, the connector cells of this part of the system are located in the brain and the sacral segments, the spinal cord. Those in the brain form parts of the nuclear origin in the cranial nerves 3, 7, 9, and 10, and the axons emerge from the brain contained in the corresponding cranial nerves. The afferent myelinated fibers travel from the viscera to the cell bodies, located either in the sensory ganglia of the cranial nerves or in the posterior root ganglia of the sacrospinal nerves. The afferent component of the autonomic nervous system is identical to the afferent component of somatic nerves and forms parts of the general afferent segment of the entire nervous system. The nerve endings in the autonomic afferent component may not be activated by such sensations as heat or touch, but instead by stretch or lack of oxygen. So they are triggered when there is lack of oxygen entering the body. So there's little oxygen entering the body. They're somewhat affected by that. So now the mucous membranes. Mucous membrane is the name given to the lining of organs or passage that communicate with the surface of the body. Mucous membranes consist essentially of a layer of epithelium supported by a layer of connective tissue, the lamina propria. Smooth muscle, called the musculans mucosa, is sometimes present in the connective tissue. A mucous membrane may or may not secrete mucus on its surface. So just because it means mucous membranes doesn't mean it secretes mucus. Like just when we have colds or coughs, does not. It may or may not secrete mucus on the surface. So on the other hand, serous membranes lie in the cavities of the trunk and are reflected onto mobile viscera lying within these cavities. They consist of a small layer of mesothelium supported by a thin layer of connective tissue. Serous membrane lining the wall of the cavity is referred to as the parietal layer, and the covering the viscera is called the visceral layer. So the parietal and visceral layer will be introduced in the coming videos that will be discussed by my classmates. The parietal layer of a serous membrane is developed from the somatopleural inner cell layer of mesoderm and richly supplied by the spinal nerves. So these parietal layers, the visceral layers, they will be discussed when we reach the lung or the thoracic wall. They will be discussed by some of my classmates in the other groups. We don't need to worry about that. This is just a brief overview. So the narrow slit-like interval that separates these layers from the pleural, pericardial, and peritoneal cavities and contain a small amount of serous liquid is called the serous exudate. So here we can see the layers that forms the pleura, in the pericardial and the peritoneal cavities. They contain a small amount of liquid. This is called the serous exudate. It will be discussed in the further videos. So now we are going to discuss about the bones. There we can see the classification of bones, surface marking of bones, and the development of bones. So the bone is a living tissue capable of changing its structure as a result of the stresses to which it is subjected. Like other connective tissues, bone consists of cells, fibers, and matrix. It is hard because of the calcification of its extracellular matrix and possesses a degree of elasticity because of the presence of organic fibers. So we can say that in a degree of elasticity because when we grow, our bones go from small to big. So year by year, day by day, our bones rather, grow little by little, centimeter by centimeter until we fully develop. So the bone has a protective function. The skull and the vertebral column, for example, the skull and the vertebral column protect the brain and the spinal cord from injury. The sternum and ribs protect the thoracic and upper abdominal viscera. It serves as a lever, as seen in the long bones of the limbs here in our arms, and as an important storage area for calcium salts. It houses and protects within its cavities the delicate blood-forming bone marrow. So within our bones, we have these delicate blood-forming bone marrows. So here we can see that it says that the bone has a protective function. So the skull and the vertebral column act like as a helmet for our brain and spinal cord from injury. The sternum and the ribs act like our vest. Imagine those playing football. They wear the helmet and the shirt under a very large lining of metal to protect themselves when they play. It's like that, protecting our lungs, the thoracic, and the upper abdominal viscera. So the bone exists in two forms, compact and cancellous. Compact bone appear as a solid mass, and cancellous bone consists of a branching network of trabeculae. The trabeculae are arranged in such a manner as to resist the stresses and strains to which the bone is exposed. So the trabeculae, they are arranged so that it can resist and actually somewhat deflect the stresses and strains to which the bone is exposed throughout our daily activities, especially when we are playing or doing vigorous activities. So bones may be classified regionally or according to their general shape. Bones are grouped as follows based on their general shape: long bones, short bones, flat bones, irregular bones, and sesamoid bones, which we are going to cover. So here is just somewhat of an overview, not really an overall discussion, because it will be discussed in the following videos, as I've said before. So the long bones. The long bones are found in the limbs, the humerus, the femur, metacarpals in our hands, metatarsals, and phalanges. Their length is greater than their breadth. They usually have a tubular shaft, the diaphysis, and is usually an epiphysis at each end. So here, our femurs in our legs, our humerus, they are considered long bones. So the ends of long bones are composed of cancellous bones surrounded by a thin layer of compact bone. The articular surfaces of the ends of the bones are covered by hyaline cartilage. So we'll get into that about cartilages. So up next, the short bones. Short bones are found in the hand and foot. Examples are the scaphoid, the lunate, the talus, and the calcaneum. So hands and our foot, like here, short bones. They are roughly cuboidal in shape and are composed of cancellous bone surrounded by a thin layer of compact bone. Short bones are covered with periosteum, and the articular surfaces are covered by hyaline cartilage. They're also covered with hyaline cartilage. So the next ones are the flat bones. So flat bones are found in the vault of the skull, here. The frontal and the parietal bones. They are composed of thin inner and outer layers of compact bone. The tables, separated by a layer of a cancellous bone called the diploe. The scapulae, although irregular, are included in this bone. In this group, the scapula. Both of our scapula and our skull, they are considered flat bones. So flat bones, as there again. Next up is irregular bones. Irregular bones include those not assigned in the previous group. Examples are the bones of the skull and the vertebrae in the pelvic bones. They are composed of a thin shell of compact bone with an interior made up of cancellous bone. So here, the sesamoid bones are small nodules of bones that are found in certain tendons where they rub over bony surfaces. So they rub over bony surfaces. The greater part of a sesamoid bone is buried in the tendon, and the free surface is covered with cartilage. The largest sesamoid bone is the patella, which is located in the tendon of the quadriceps femoris. Other examples are found in the tendons of the flexor pollicis brevis and flexor hallosis brevis. So this will be covered in another video by my classmates. They will delve in that further. So now we go to the surface markings of the bone. This is just an overview, by the way. The surfaces of bones show various markings or irregularities, or bands of fascia, ligaments, tendons, or aponeuroses are attached to the bone. The surface is raised or roughened, so they are either raised or roughened. It actually varies. They appear at puberty and becoming progressively obvious during adult life. So the bone marrow. The bone marrow occupies the marrow cavity in the long and short bones, and the interstices of the cancellous bone in flat and irregular bones. At birth, the marrow of all the bones of the body is red and hematopoietic. This blood-forming activity gradually lessens with age, and the red marrow is replaced by yellow marrow. So at birth, it is red, and as we age, it becomes yellow. It turns into a yellow marrow. At 7 years of age, the yellow marrow begins to appear in the distal bones of the limbs. This replacement of marrow gradually improves proximally, so that by the time the person becomes an adult, red marrow is restricted to the bones of the skull, the vertebral column, the thoracic cage, the girdle bones, and the head of the humerus and the femur. So here we are in the development of the bone. So the bone is developed by two processes, the membranous and the endochondral. In the first process, the bone is developed directly from a connective tissue membrane, and in the second, a cartilaginous model is first laid down and is later replaced by bone. So before, there are places in our body which didn't have bones yet. There were cartilages, small cartilages was first laid down there. Then it just developed into a bone for the bone to sit there. The long bones of the limbs are developed by endochondral ossification, which is a slow process that is not completed until the 18th to 20th year or even later. So the long bones undergo endochondral ossification. So they are not fully completed until the age of 18 or even until like in our late 20s or 30s. So it is continuous. Usually it stops by 18 or 20 during our 20th year. The bones of the vault of the skull are developed rapidly by the membranous method in the embryo, and this serves to protect the underlying developing brain. So even when we are still fetuses, our bones, especially the skull, develop earlier to protect our very fragile brain. So cartilages. Cartilage is a form of connective tissue in which the cells and fibers are embedded in a gel-like matrix, the latter being responsible for its firmness and resilience. So these are not the cartilage these are human cartilage. The three types of cartilage are as follows: the hyaline cartilage, the fibrocartilage, and the elastic cartilage. So the hyaline cartilage has a high proportion of amorphous matrix that has the same refractive index as the fibers embedded in it. Throughout childhood and adolescence, it plays an important part in the growth and length of long bones. Epiphyseal plates are composed of hyaline cartilage. So earlier we said that the long bones are epiphyseal in origin. It has a great resistance to wear and covers the articular surface of nearly all synovial joints. Next up is the fibrocartilage. It has many collagen fibers embedded in a small amount of matrix and is found in the discs within joints. An example would be the temporomandibular joint and the sternoclavicular joint and knee joint, and on the articular surfaces of the clavicle and mandible. The fibrocartilage, if damaged, repairs itself slowly in a manner similar to fibrous tissues elsewhere. Joint discs have a poor blood supply and can therefore do not repair themselves when damaged. So they do not repair themselves also the hyaline cartilage do not repair themselves when damaged. So next, elastic cartilage. It possesses large numbers of elastic fibers embedded in the matrix. As would be expected, it is flexible and is found in the auricle of the ears, which have the smallest bones. The external auditory meatus, the auditory tube, and the epiglottis. The elastic cartilage also, if damaged, the elastic cartilage, if damaged, repairs itself with fibrous tissues, unlike the hyaline and the fibrocartilage. So here we are on the effects of sex, race, and age on the structure of our bones and our body. So here we can see a comparison between the male and female. So in the male, they tend to be taller and have longer legs, while the female tend to be shorter. So this actually varies from race to race. Here in the Philippines, we have shorter. We also have shorter men than women, and outside of our country, they have men and women who I think reach up to 7 foot tall. So the male bones are bigger and heavier, while the female bones are lighter. So the male has less subcutaneous fat, while the female has more subcutaneous fat accumulation, especially in the breasts, buttocks, and thighs, especially around puberty, which accumulate the growth of our body. So in the male, the larynx is larger and vocal cords are longer, making the voice deeper. While in the females, as you can see, their larynxes stay with them. Like when they are teens, their voices are the same up until they age. It's like their larynx doesn't grow. It's just the same. While the females also have less bulky muscles. It's 2021 and we have many champions, especially in weightlifting, who have massive muscles rather. So here in the female, hair is finer, though many males suffer from baldness. An example would be me, which is genetic, has large breasts and wider pelvis than the male. The females also have wider carrying angle at the elbow and a greater lateral deviation of the forearm. So here we can see the female accumulates large breasts, especially in puberty, as I've said, and has a wider carrying angle at the elbow. So these all happen in puberty. They grow and develop more structures in their body. So until the age of approximately 10 years, boys and girls grow up at about the same rate. So from ages 0 to 10, boys and girls, scientifically speaking, grow the same rate. Around 12 years, boys often start to grow faster than girls. So we can see our classmates, especially when graduating from elementary school, we see that our classmates before who were shorter, now after summer became really taller than us, which is a good example. So that here we can see that boys often start to grow faster than girls around this time of puberty, this time of teenage years. So that most males reach a greater adult height than females. This is why most males, especially those who play basketball in the early days of their lives, grow to be tall. Next one. So puberty begins between the ages 10 and 14 in girls and between 12 and 15 in boys. In the girl at puberty, the breasts enlarge, the pelvis broadens. At the same time, a boy's penis, testes, and scrotum enlarge. In both sexes, axillary and pubic hair appear. So this is where we see growth of hair where the least we expect it, such as in our underarms, in our pubic area. And here we can also see that the girls develop a growth, especially in their chest, in their breast area, massive subcutaneous fat accumulation, and also their pelvis broadens. So in the boys, their penises, they would rather get circumcised or uncircumcised, their testes and scrotum they enlarge. So next, racial differences may be seen in the color of the skin, hair, and eyes, and in the shape and size of the eyes, nose, and lips. Africans and Scandinavians tend to be tall. They are also fast runners and they're really good with volleyball. It's kind of a racial hood, but they are. As a result of long legs, whereas Asians tend to be short, with short legs. The heads of Central Europeans and Asians also tend round and broad, so Asians are short, which is actually kind of real. You can see everyday people. So after birth and during childhood, the bodily functions become progressively more efficient, reaching their maximum degree of efficiency during young adulthood. During late adulthood and old age, many bodily functions become less efficient. So as we grow older and older, um, from 0 to 10 years until our teenage years, our body functions grow more rapidly and more efficiently to help us adapt to our daily lives, our new daily lives and daily routines. While during late adulthood, such as in our late 50s, early 60s, like that, some of our bodily functions deteriorate. So there are some body functions that we cannot do anymore. We can only do with the help of crutches like that or the canes. That's why some of our lolas and lolas wear canes or the walkers to help themselves walk or be limber again. So after birth and during childhood is the same. We can really see that, especially now in our lifetimes where they say that the life expectancy has gone back up to 70 years old again, that we are experiencing, especially during the prime of our lives where our bodies um, give out more to us so that we can move daily. So now we are here in our rationalization stage. So we can see in the final portion of our discussion, we will discuss the importance of general anatomy, especially in our course chosen, which is dentistry. So the importance of general anatomy in dentistry, it gives us a sense of understanding as to how our body and the different parts work. It enables us to understand where we need to take care of ourselves. And it is one of the main subjects in the board examination, which was said by our dean in our orientation in our first year. It correlates with our oral anatomy subject, which we'll be having at the end of our block. At the end of our SEM, and gives us a deeper, not surface knowledge of our body, and gives us a purpose to lead and live a healthy life. So as sinasabi nating mga alagad ng health, it is our duty not only, and it is our duty as dentists, also as doctors in the field, to take care not only of our mouths but also all of us, all of our bodies, the whole of our bodies, because we cannot move if we are sick, if we are weak. We need to take care of it. We need to understand that every part is essential in moving, and every part gives us a purpose to move, to do our routines every day. So it is also important that we give ourselves time to study this subject. Give it more priority, because especially here in dentistry, it is one of the main subjects in the board examination. So we really have to reread this when we arrive at the point where we have to take our board examinations. So that about sums it up to the introduction of general anatomy for our subject. So it was only brief, and the coming videos to be submitted by my classmates will help us further understand the different and the deeper knowledge within our body. Thank you for listening, and this has been Rogielle Andrew M. Abog of Group 1 from DDM 28.
Anatomy, from the Greek words ana, which means up, and tom, which means a cutting, is considered the oldest scientific discipline in medicine. The father of anatomy. The study of human anatomy dates back less than 2,000 years ago to the ancient Greeks, with Herophilus being the first person to perform systemic dissections of the human body and hence was recognized as the father of anatomy. General anatomy. It builds an understanding of body structures. It is in the subject that students learn about the major systems of the human body and how these systems all work together and depend on each other to function properly. A thorough knowledge of body structure is fundamental to understanding bodily functions and how both structure and function can be modified by disease.